Today, we'll be looking at psychotherapy briefly. My name is Dr. Boakye-Boama. I'm a medical doctor and a resident in the psychiatry department, Kumasi, Ghana. My email is peterboakye27@gmail.com. To begin with, we'll look at what psychotherapies are. Psychotherapies are a collection of treatments for mental disorders which employ language and communication and the relationship with a skilled therapist as their means of producing change. The core components of psychotherapy are empathetic and non-judgmental stance of the skilled therapist towards the patient. It is also important to establish a therapeutic relationship between the therapist and the patient. Indications for psychotherapy are depressive illness, that's mild and moderate, neurotic illness, eating disorders, personality disorders, learning disabilities, psychosexual problems, substance misuse disorders, and chronic psychotic symptoms. Contraindications to psychotherapy includes acute psychosis, its reason is given here, severe depression, the reason is given, dementia or delirium, and acute suicidal risk. Selection of psychotherapeutic method. The factors to consider are local availability, which one is available in your locality, the practitioner's experience, that is what the doctor is comfortable with, illness factors, various illnesses respond to different treatments, and the patient's choice may be considered. Types of psychotherapy. There are three main types of psychotherapy: supportive psychotherapy, psychodynamic psychotherapy, and cognitive behavioral therapy. Other types of psychotherapies include 1. Group psychotherapy, 2. Behavior therapy, 3. Interpersonal psychotherapy, 4. Dialectical behavior therapy, 5. Cognitive analytic therapy, 6. Solution-focused therapy, and 7. Counseling methods. Less known types of therapeutic approaches are written here. Now let's look at the main types of psychotherapy. 1. Supportive psychotherapy. This offers practical and emotional support. Examples are counseling and general psychiatric follow-up. Then 2. Psychodynamic psychotherapy. This aims to produce changes in an individual's thinking and behavior. It does this by exploring the individual's childhood experience and the unconscious mind. It is based on psychoanalysis. Cognitive behavioral therapy. This is directed towards the patient's current thoughts and behaviors, which are closely examined and challenged with a view to modify them to improve symptoms. The details are here. Now let's look at other types of psychotherapies. We have 1. Group psychotherapy. Here, selected individuals are brought together under the guidance of a therapist. The details are here. Types of group therapy are here. 2. Behavior therapy. This is based on learning theory and uses some specific techniques. Some of these techniques are 1. Systematic desensitization. Systematic graded exposure to the source of anxiety is coupled with the use of relaxation techniques. This is effective for simple phobias, but less so for other phobic or anxiety disorders. Under behavioral therapy, another technique is flooding or implosive therapy. Here, the patient is exposed to the phobic objects and escape or avoidance is prevented. This use this causes extension of the usual anxiety response. The next one is behavior modification. This is based on operant conditioning. Here, the person is rewarded for small things that the person does, and it's usually common for children, where childhood nocturnal enuresis is usually kept using this method. Another technique is aversion therapy and covert sensitization. This involves the use of negative reinforcement, that's the unpleasant consequence of a particular behavior, to inhibit the usual maladaptive behavioral response. The third type of other therapy is interpersonal psychotherapy. This was developed following observation of depression, where there was usually impaired interpersonal functioning. Interpersonal psychotherapy, that's IPT, aims to improve interpersonal functioning and emotional symptoms. The details are here. 5. Dialectical behavioral therapy. This is used in the treatment of borderline personality disorder, that's BPD. The details are here. 6. Cognitive analytic therapy. It aims to bring together ideas from dynamic cognitive and behavioral therapies by attempting to explain psychoanalytic ideas in cognitive terms. 7. Solution-focused therapy. This aims to empower patients to recognize and use their own strengths. It is a brief intervention which may be delivered in a single session. The details are written here. Counseling methods is a method of relieving distress undertaken by means of a dialogue between two people. The details are written here. Other less known types of therapeutic approaches are mindfulness-based cognitive therapy. The details are written here. Acceptance and commitment therapy. The details are written here. Compassion-focused therapy. The details are written here. Schema therapy. The details are written in bold here. Metacognitive therapy for depression. The details are written here. Behavioral activation. The details are written and deepened here. Functional analytic psychotherapy. The details are deepened in black over here in bold. Cognitive behavioral analysis system of psychotherapy. This was specifically developed to treat patients with chronic depression. Integrative behavioral couple therapy. This aims to promote acceptance and tolerance. And third wave therapies. At this juncture, we come to the end of our discussion, and as usual, our quote is protect your mind, for it is your home. Thank you.